Hi, I am Dr. VP Gangadharan, medical oncologist working in VPS Lakeshore Hospital, Kochi, Kerala, India. I have been in this profession for the last 30 years. So I say something like starting from 1989, 1990. I think as I told you already, I'm an oncologist. That means I'm a cancer specialist. So my talk today will be on my topic, oncology or cancer. I think the word itself is scary to many of you. Why this scare? That's a question to be addressed. The answer is straightforward. There's an increasing incidence in cancer all over the world, our country too. Almost 15 lakhs new cases of cancer are registered every year. And if you take the small state of Kerala, every day we see about 120 plus new cases. It's on the increase. But with the same token, we'll immediately say that though the cancer is increasing, the cure rate is also going up. That means the number of people who are getting cured of the disease is also on the hike. So the question automatically asked is cure alone your aim of treatment? No. When you speak about aims of cancer treatment, it starts off like this: prevention, early detection, cure, prolongation of survival, and palliation. When you speak about prevention, the first question to be addressed is, can you prevent all cancers? Or are all cancers preventable? The answer is a double emphatic no. But 30% of the cancers are preventable, 30%, almost 1/3 are preventable. And almost 1/3 are screenable. That means you can go for early detection. Cure rate, if you take on a broad spectrum, or on a broad base, with the number of patients coming to a hospital, 45 to 50% of the cancers or cancer patients are curable. And if you take the pediatric population, that means children, 70 to 80% are curable. For about 30% of the patients, you can have prolongation of life. That means they live with good quality of life. You take a diabetic patient, or a patient with a hypertension, you are not curing them. They live with the disease and lead a normal life. Like that, 1/3 of the cancers you can go for a prolongation of life with good quality of life. Another 1/3, they are neither curable nor can you prolong their life, but you can give them a good quality of life for as long as they live. That means it's purely palliative. So there are all these strong pillars in the treatment of cancer. So the first question is prevention. I already told you 1/3 of the cancer are preventable. And your plan of action is no tobacco, no alcohol, your dietary habits plus exercise. These are the 3 tools in the prevention of cancer. And out of this, the most important is tobacco. So if somebody asks, what is your first step in the prevention of cancer? I think it's against tobacco in any form. Because based on how you are going to use the tobacco products, your site of cancer varies, that's all. Alcohol is equally the problem. And if somebody is a smoker and at the same time is an alcoholic too, then all the cancers that are associated with the use of tobacco rise by tenfold. So the question is, what are the cancers related to the use of tobacco? Lung cancer, head and neck cancers, laryngeal cancers, they are all connected, directly linked. And you've got a lot of cancers where they contribute. That means not directly linked, but they add to, like cervical cancers, bladder cancers, kidney cancers, and an array like that. So if somebody asks back, what is the most important stand against, or what is the most important plan in prevention of cancer? I think the first 10 steps are going to be against tobacco, against tobacco, against tobacco, like that. So I told you tobacco plus alcohol. There are certain cancers which are very closely associated with the use of alcohol also, like esophageal cancers, stomach cancers, liver cancers, where alcohol plays a role. So, no tobacco, no alcohol. Third is your dietary habits. I think the caption is very simple, but self-explanatory, like fast food kills fast. Why the caption is because high fat, high calorie diet, lack of exercise, obesity. You have got a list of cancers, not only cancers, even others. But if you take the cancers as a whole, the breast cancer, uterine cancers, colonic cancers, I think the link goes like that. And if you take a little bit more, high fat, high calorie diet and lack of fiber diet, you are prone to go for a colon cancers. So the diet has to be modified, or changed. That means you should be able to prevent obesity developing, add exercise to your plan of action, and prevent obesity. What are said and done? Green leafy vegetables and fruits, they got a protective effect in cancer. That means it has to be included in your diet. So the best healthy plate for you to take food, I'll put it across, is 50% of the plate should be filled with green leafy vegetables and fruits. 25% is grain of your choice, and 25% is protein of your choice. That's your best plate you can ever imagine. So I think preventing obesity by diet plus exercise forms your next step. 30% of the cancers are screenable. That means early detection is possible, because the basic dictum is early detection and proper treatment, that's the tool for cure. So you should be able to detect them early. Breast cancers, head and neck cancers, cervical cancers, colon cancers, and prostate cancer. They are all screenable. That means there's a definite plan of action to detect them at an early phase. You've got two vaccines that you can think of at this point of time. They are not direct anti-cancer vaccines, but they have an effect on the causative effect. And the two viruses implicated are, one is hepatitis B virus, the causative factor for a liver cancer, and human papilloma virus, the causative factor for a cervical cancer. And HPV virus, the ideal age group is girls between 10 to 26 years, can go up to 40 years, but ideal age group is 10 to 26 years, and 3 doses has to be taken, this month, second month, and 6th month. But be very clear that it's not anti-cancer vaccines, but they are directed against the virus implicated against that cancer. So we have covered 2 steps: prevention, early detection. So the next step is treatment or cure. how far we have reached and what are the changes which has been happening for the last 30 years. The four major arms of treatment are surgery, radiation, chemotherapy, and immunotherapy. And the three players in this game are surgical oncologists, radiation oncologists, and medical and pediatric oncologists. All areas we have changed a lot. And the basic concept has changed, like it's a comprehensive cancer treatment approach. That means surgeon, radiation oncologist, medical oncologist, they all sit together and plan treatment, not as single person. If you take the advancements in the field of surgery, I think crude mutilating surgeries have given way to conservative surgeries without finally touching upon the outcome. That means, if possible, you should be able to preserve the organ rather than fully removing the organ. For example, breast cancer. If there's any chance, you will try to preserve the breast. And laparoscopic surgeries and plastic reconstruction techniques, they all have contributed on their own. When it comes to radiation oncology, the precision has become the art of the day. That means you are not at all interested in killing cancer cells. It's the other way. You are not at all interested in killing normal cells. You are interested in killing only the cancer cells. So you try to focus on the cancer cells and kill them, that area alone, preventing the normal cells getting killed. So newer machines like linear accelerators and lot of techniques like IMRT, IGRT, they all have contributed for this. If somebody asks me which field of oncology has gone for the maximum advancements, I think the answer is straightforward. It's medical oncology. You have got newer drugs with much less side effects, because you will be scared about the side effect called as a hair loss. You have got drugs without hair loss. You have got drugs called as targeted chemotherapy. That means you are interested in only killing the cancer cells, not the normal cells. So you can target the cancer cells. I think this advance has happened. And if you ask me, what about immunotherapy? We have learned that we can equip our own cells. That means our own immune system to fight against the cancer cells, the T cells. So the sleeping T cells, they can get up and they can wake up and they can finish the cancer cells. So like that, we have improved in every field to say that cancer is a curable disease. Much more research has again happened in the field of oncology. Like for every cancer, there is a driver mutation. That means one genetic mutation is the driver or responsible for that cancer. And if you can identify that mutation and you can target it, best treatment option is going to be there. And which has taught us a lesson that if you take two breast cancers, they are not similar because the driver mutations are different. Whereas a breast cancer and a lung cancer may be similar because the driver mutation is same. That means rather than the diseases going like this, we can say that by identifying driver mutations, you are able to treat. And so these are the advancements. So the question is, are we also doing the same thing? Yes, we are doing it. But we need a advancement in basic research. That should be part of our next plan, because our country has to come up with our own protocols, our own basic research methodology, our own basic research to say that this is our data and we are going on to rely on this. COVID has taught us this lesson because COVID has shown that our cell system is very good and we can be equipped or can be better or on par with any of the best systems in the world. USA has collapsed. We have got shady eyes on WHO now, but we sustained. We fought. We are still fighting. That should be our motto. That should be our plan. So why we want to go for a change is, we should be able to see what we have learned from this. Like there should be a stop and a pause and a restart. And I think that is something which is going to be there. I think the sequence can be different, but a restart is one which has to be part of it. And that restart, we should be thinking that we should improve probably on our telemedicine systems. We should be relying some of our artificial intelligence. And the basic primary health system has to go forward still. And if that's to happen, I'm sure that we'll be a winner. So just like we are going to conquer COVID, I think that day is not far off. From this day, I'm going to count and say that maybe, say 3 years, 4 years or 5 years from now, we'll be conquering this disease, cancer, with just like any other disease, preventable, screenable and curable.